As a brain doctor, I must tell you something that many people do not realize. Stroke is not only one of the most common medical emergencies in older adults, it is also one of the most preventable. If we learn to pay attention to the warning signs, after the age of 50, the risk of stroke rises sharply. And in fact, more than 8 out of 10 strokes occur after this age. In countries around the world, including the United States and Vietnam, stroke is among the top causes of death and disability. Many survivors are left unable to walk, speak, or live independently, placing a heavy burden on families. What makes stroke especially dangerous is that it can strike suddenly. Yet the body often whispers clues before the crisis arrives. Subtle changes in vision, unexpected numbness in the face or limbs, sudden difficulty speaking, or a headache unlike any you have felt before are all signals that the brain is in distress. Ignoring these warnings can mean the difference between recovery and permanent damage. The good news is that immediate recognition and urgent medical care can limit brain injury and save lives. In this video, I will guide you through the early signs of stroke that seniors and their families must never ignore, the different types of stroke, and the most effective steps for prevention. Your awareness could one day save your life or the life of someone you love. As you listen, think carefully about your own habits and experiences. If you or your family have ever noticed any of these warning signs, share your story in the comments below. Your experience may help another viewer recognize a danger in time. 1. Understanding stroke in older adults. To truly protect yourself or a loved one, you must first understand what a stroke actually is and why it becomes so common in later years. A stroke occurs when blood flow to part of the brain is suddenly interrupted. Without oxygen and nutrients, brain cells begin to die within minutes. This interruption can happen in 2 main ways. The first and most common is an ischemic stroke, caused by a clot blocking an artery. The second is a hemorrhagic stroke, which happens when a weakened vessel in the brain bursts and bleeds into surrounding tissue. Both types are medical emergencies that can change a life in seconds. Older adults are particularly vulnerable because aging naturally makes blood vessels less flexible and more prone to damage. Years of high blood pressure, cholesterol buildup, or heart rhythm problems silently weaken the circulatory system. By the time a person reaches 60 or 70, these hidden changes increase the chance of either a clot or a vessel rupture. Statistics reveal that nearly 7 out of 10 strokes occur after the age of 65, and the outcomes can be severe. Many survivors face long-term disability, from paralysis and speech problems to memory loss and difficulties with daily activities. Families often underestimate the impact until they see a parent or spouse suddenly dependent on others for the simplest tasks. Understanding the seriousness of stroke also means recognizing that it does not always kill instantly. For some, survival comes with years of rehabilitation, frustration, and emotional strain. Yet it is important to remember that recovery is possible. The human brain has remarkable ability to adapt, especially when treatment begins quickly. Early therapy and consistent care can help many seniors regain independence, though often not fully. This is why awareness is so critical. Stroke is not just a random tragedy. It is a disease strongly linked to preventable risk factors. By understanding what stroke is and why it becomes more common with age, you give yourself the power to act quickly and to invest in prevention. Knowledge is the first defense, and with it, you can greatly reduce the odds of waking up one day to a medical emergency that could have been anticipated. 2. Early warning signs you must never ignore. One of the most dangerous misconceptions about stroke is the belief that it happens without any notice. In reality, the body often sends out urgent warning signals, but too many people dismiss them as fatigue, stress, or simply part of getting older. Recognizing these signs can make the difference between a manageable recovery and a lifetime of disability. One of the earliest and most telling signs is sudden numbness or weakness, usually affecting the face, arm, or leg on one side of the body. A smile may suddenly appear uneven, or a hand may lose its strength when trying to grip a glass. This is not clumsiness. It is the brain struggling to send signals to the muscles. Another warning is vision problems. A person may find that sight in one or both eyes becomes blurry, dim, or even lost altogether. This can happen so quickly that it feels like someone pulled a curtain over the eye. If ignored, the underlying clot or bleeding can worsen and cause irreversible blindness or brain injury. Severe headache is also a critical sign, especially if it appears suddenly and feels unlike any headache experienced before. Many older adults are tempted to brush it off or take a painkiller. But a sudden, intense headache can mean a vessel inside the brain has ruptured. Immediate medical help is essential. Difficulty speaking or understanding words is another red flag. A person may slur their words, struggle to form sentences, or find it hard to comprehend simple instructions. This is not just confusion. It is the brain failing to process language, and every passing minute means more brain cells are at risk. Problems with balance or coordination can also signal an oncoming stroke. If walking becomes unstable, or if a person suddenly feels dizzy and unable to stand, it may reflect damage in the areas of the brain that control movement. Families often notice these changes first, so it is vital to act quickly and not wait to see if symptoms improve. The golden rule is simple. If any of these warning signs appear, call emergency services immediately. Do not wait to see if the symptoms go away, because in many cases they do not. Early treatment with clot-busting drugs or surgical procedures can dramatically reduce damage if started within the first few hours. Delaying, even for a short time, can mean the difference between walking out of the hospital or facing permanent disability. Stroke is a race against time, and every minute counts. Recognizing and responding to these early warning signs is one of the most powerful ways to protect yourself and your loved ones. Do not assume that age alone explains sudden weakness. Vision loss, speech problems, or severe headaches. Treat them as medical emergencies, and you may save a life. 3. The different types of stroke in seniors. To understand how to protect yourself from stroke, it is essential to know that not all strokes are the same. Although the result is always a sudden interruption of blood flow to the brain, the way it happens and the outcome can be very different. Broadly speaking, there are two main types of stroke that affect older adults, and each carries its own dangers. The first and most common is called an ischemic stroke. This occurs when a blood clot blocks one of the arteries leading to or within the brain. Often this blockage is the result of a condition known as atherosclerosis, where cholesterol and fatty deposits build up along artery walls over many years. As the artery narrows, blood flow becomes restricted and clots can easily form. Sometimes a clot forms in another part of the body, such as the heart, and then travels through the bloodstream until it becomes lodged in a vessel of the brain. Either way, the result is the same. Oxygen and nutrients can no longer reach the brain cells beyond the blockage, and within minutes, those cells begin to die. Ischemic strokes account for nearly 9 out of 10 cases. And while some patients recover with quick treatment, others face lasting impairments, depending on how long the brain was deprived of blood. The second type is called a hemorrhagic stroke, and though less common, it is often more deadly. This occurs when a weakened blood vessel inside the brain bursts and spills blood into the surrounding tissue. High blood pressure is one of the leading causes, because constant pressure against vessel walls can cause them to thin and eventually rupture. Another cause is an aneurysm, a balloon-like bulge in a vessel wall that can suddenly give way. When bleeding occurs inside the brain, pressure builds rapidly, often causing severe headache, vomiting, loss of consciousness, and in many cases death. Survivors may face significant challenges. But interestingly, some elderly patients who live through a hemorrhagic stroke can experience a better chance of recovery compared with ischemic stroke. Since, once the bleeding is controlled, the brain tissue may heal more fully. Understanding these two types of stroke is crucial because the treatments are completely different. For ischemic stroke, clot-dissolving drugs or surgical removal of the clot can restore blood flow if given quickly. For hemorrhagic stroke, however, those same drugs would make bleeding worse. Instead, doctors must focus on lowering blood pressure, repairing the damaged vessel, or relieving pressure inside the skull. This is why time and accurate diagnosis are so critical. Knowing that both types exist helps families and caregivers appreciate the urgency of immediate hospital care. Stroke is not a single disease, but a group of conditions that attack the brain in different ways. By understanding these differences, you are better prepared to respond wisely if warning signs ever appear. 4. Prognosis and recovery in older adults. When an older adult suffers a stroke, the question families often ask is simple yet difficult: what comes next? The truth is that prognosis after a stroke depends on many factors, including the type of stroke, the area of the brain affected, the speed of treatment, and the overall health of the patient before the event. For ischemic stroke, survival rates are generally higher, but recovery may be slow and complicated by permanent disability if treatment was delayed. For hemorrhagic stroke, the risk of death is greater. Yet, those who survive sometimes regain function more fully. Once bleeding is controlled, age also plays a critical role. As the body grows older, blood vessels are less resilient, the brain heals more slowly, and other chronic illnesses such as diabetes or high blood pressure interfere with recovery. Still, age does not mean there is no hope. Many seniors regain significant independence through rehabilitation if therapy begins early and continues consistently. Doctors assess recovery potential by looking at many functions: eye movement, awareness, ability to speak and understand, facial control, arm and leg strength, coordination, and sensation. Even small improvements in these areas are important signs that the brain is finding ways to adapt. Rehabilitation is more than physical therapy. It often includes speech therapy for those who struggle with language, occupational therapy to help patients relearn daily activities, and counseling to address the depression and frustration that so often accompany stroke. For some, recovery is measured not by complete return to normal, but by regaining enough ability to feed themselves, walk with assistance, or communicate their needs. Every regained skill adds dignity and lessens the burden on caregivers. Families must prepare for the possibility that recovery will be partial. Statistics suggest that nearly 1/4 of stroke survivors are left with mild disability, while close to half live with moderate to severe impairment. These numbers are sobering, but they should not erase the fact that early recognition and treatment dramatically improve outcomes. Quick hospital care often reduces brain damage, making rehabilitation more successful. Prognosis is not a fixed sentence, but a path influenced by timely action and continuous care. It is also important to note that recovery does not end after a few weeks in the hospital. Many patients continue to make progress months and even years later if they remain committed to therapy and lifestyle changes. Families should understand that patience, encouragement, and persistence are as vital as medical treatment. Stroke is not only a medical crisis, it is a long journey of healing. With immediate care, structured rehabilitation, and strong support, many older adults can regain quality of life and prevent a second stroke. 5. Prevention strategies for seniors. While treatment can save lives, the most powerful weapon against stroke is prevention. For older adults, prevention is not about one single action, but about building a daily routine that protects the brain and heart from silent damage. The first and most essential step is controlling blood pressure. High blood pressure is the single greatest risk factor for both ischemic and hemorrhagic stroke. Yet, it often goes unnoticed because it produces no pain. Regular monitoring, proper medication when prescribed, and lifestyle changes such as reducing salt intake and maintaining a healthy weight are crucial. Keeping blood pressure within safe limits is like reinforcing the walls of a dam before a flood arrives. Another cornerstone of prevention is managing cholesterol and blood sugar. High cholesterol contributes to clogged arteries, while poorly controlled diabetes weakens vessels and accelerates atherosclerosis. Seniors should work closely with their doctors to track these numbers, adjust medications, and follow diets rich in vegetables, fruits, lean proteins, and healthy fats. Small changes in diet, such as replacing fried foods with baked or grilled options and choosing whole grains instead of refined carbohydrates, can make a lasting difference. Avoiding harmful habits is equally important. Smoking directly damages blood vessels and promotes clot formation, while excessive alcohol raises blood pressure and increases the risk of irregular heart rhythms that can trigger a stroke. Quitting smoking and moderating alcohol intake are two of the most effective decisions a senior can make to lower stroke risk almost immediately. Physical activity also plays a critical role. 30 to 45 minutes of moderate exercise most days of the week strengthens the heart, improves circulation, lowers stress, and supports a healthy weight. Activities such as walking, tai chi, or swimming are gentle on joints, yet highly effective in maintaining vascular health. Stress management is another underestimated strategy. Chronic stress keeps blood pressure elevated and fuels unhealthy behaviors. Relaxation techniques, breathing exercises, or simply engaging in enjoyable hobbies can protect both mind and body. Finally, seniors should never underestimate the importance of regular medical checkups. These visits provide opportunities for early detection of heart rhythm problems, clogged arteries, or other silent conditions that might otherwise go unnoticed until a stroke occurs. In some cases, doctors may prescribe blood-thinning medications for those with atrial fibrillation or other high-risk conditions. Prevention is not about perfection but about persistence. No single action can guarantee safety, but the combination of healthy choices compounds over time to create strong protection. Think of each healthy habit as adding another layer of armor around your brain. The earlier these changes are made, the greater the benefit. But it is never too late to start. Even small steps taken today can lower your risk tomorrow. For seniors, prevention is not optional. It is the difference between years of independence and the sudden loss of speech, mobility, and freedom that stroke can bring. Doctor's final words. As a brain doctor, I want to leave you with a message that is both urgent and hopeful. Stroke is one of the leading causes of death and disability in older adults. Yet so many of its devastating outcomes can be prevented. The danger lies in how easily the warning signs are ignored and how often the necessary changes are delayed until it is too late. Stroke does not only steal speech, movement, or memory. It can take away independence and transform the life of a family in an instant. But the hopeful truth is this: every healthy decision you make, no matter how small, shifts the odds in your favor. Scheduling regular checkups, eating with awareness, moving your body daily, giving up harmful habits, protecting your sleep, calming your stress, and staying socially connected are not just lifestyle choices. They are lifelines for your brain. Prevention is not about living in fear. It is about living with strength and intention. Even if you are over 60 or 70, it is never too late to begin. The brain responds positively when given the chance, and each step toward health adds resilience. I urge you not to wait for symptoms to force your hand. Do not dismiss sudden weakness, vision loss, slurred speech, or unusual headaches as simple signs of aging. Treat them as alarms that demand immediate attention. Quick action can save a life, and quick prevention can protect a future. If you take one lesson from this video, let it be that your choices today decide the kind of life you will live tomorrow. Stroke may be common in older age, but it is not inevitable. Protecting your brain is within your reach. Share your thoughts in the comments below and let me know which of these habits you are ready to strengthen. Your story may encourage someone else to take action before it is too late. Together, by spreading awareness and making changes, we can prevent strokes and help more seniors live with clarity, dignity, and independence for many years to come.